been a co-commissioning exercise across Bath and North East Somerset, Swindon and Wiltshire to tender for a new, integrated community primary and specialist child and adolescent mental health service CAMHS. Oxford Health NHS Foundation Trust have now been named as a preferred service provider, and the service is due to go live from the 1st of April 2018. In April 2017, the Wiltshire Parent Care Council held consultations in Chippenham and Salisbury, in conjunction with Wiltshire Council, to provide an opportunity for parent carers to have their input into shaping the new service model. A total of 31 parents and carers attended. The session started with James Fortune, Wiltshire's lead commissioner for children and young people's mental health, explaining the background and research around children and young people's mental health, both nationally and locally, which showed why changes are needed. He also presented the preferred provider's proposed new service model, and there was plenty of opportunity for parent carers to ask questions throughout the presentation, which was followed by around-the-table discussions to get further views. Other public consultations are also taking place with stakeholders, parents, carers and young people to get further input. All the collated feedback will be used to help develop and refine the service model, which will lead to an agreed service specification. Other public consultations are also taking place with stakeholders, parents, carers and young people to get further input. All the collated feedback will be used to help develop and refine the service model, which will lead to an agreed service specification. Background. 75% of adult mental health issues start before a person reaches age 18, so early intervention is obviously key. But there is currently a feeling from families that the current system is too complicated and they are bounced around between services. There has been a rise in demand for mental health services for children and young people, particularly teenage girls, presenting at AR GP surgeries with a range of issues, for example, young women in emotional distress, more children and young people, some aged as young as 8 or 9, with eating disorders. The world has changed since the last CAMHS model was set up 10 years ago, with many children and young people now living life online with the added negative pressures associated with this. For example, late nights online mean loss of sleep as well as online bullying, which means that nowadays bullying no longer stops at the school gates. Waiting times for a first appointment can be up to 4 or 5 weeks in Wiltshire, and the CAMHS thresholds for help are very high, so those who do manage to access the service usually have very complex needs or are going into crisis and so are resource intensive. It was mentioned by a parent attending the consultation that some GPs are using old data to diagnose ASD, which can result in those children and young people with autism finding it difficult to gain access to CAMHS. Future in Mind report. This was a paper published by central government in 2015 which highlighted the inconsistent mental health provision across the country. It set out to improve the provision by CAMHS by consulting with parents, children and young people about their experience. The key themes of the report were: there is a need for early intervention to equip children and young people with the resilience needed to deal with the bad times in their lives, for example family breakup or illness. There needs to be improved access to the service. It was recognized that vulnerable young people like travelers, Black, Asian and ethnic minorities, children with special educational needs and or disabilities, and looked after children often experience barriers to the service. CAMHS should be accountable and transparent. The workforce should have the training needed to make them confident and skilled enough to deal with children and young people's emotional health. During the consultation, young people often said they just wanted someone to talk to, whereas professionals felt they did not have the confidence to deal with young people. The time a professional GP, etc. has at an appointment with a young person is often too short to make a proper assessment. Following the Future in Mind report, all areas of the country are now required to have their own transformation plan for children and young people's emotional well-being and mental health, which focuses on the themes mentioned as well as addressing issues at a local level. The Thrive model. In Wiltshire, the transformation plan and the new CAMHS service will follow the Thrive model, which was developed by the Anna Freud National Centre for Children and Families. This model of care is an integrated, person-centred and needs-led approach to delivering mental health services for children and young people. Tears will be removed, and this new approach represents a significant shift away from a traditional, reactive and medical-based service delivery model to an increased emphasis on early intervention and prevention. The Thrive model focuses on 4 categories of need and support. 1. Coping. Children and young people in this category are, for the majority of the time, coping well, but will occasionally have a tough period where they may need a little extra support, for example bullying, bereavement or divorce. 2. Getting help. Children and young people in this category may benefit from some short-term evidence-based support. For example, a teenager with anxiety may need some cognitive behavior therapy (CBT). 3. Getting more help. Children and young people in this category may need more extensive, longer periods of help, for example those with personality disorders or psychosis. They may need a short stay in patient place. 4. Getting risk support. Children and young people in this category are in crisis and need an emergency response. In this case, social care may take a lead role. Previous treatments and support may not have worked. During the consultation, parents said that CAMHS should take the lead role at this point, as social care could make wrong judgments if a young person's medical or mental health needs are not known. Social care should only take a lead if the young person is already known to them or there are safeguarding issues. Emergency beds are also not always available or not local, so a child or young person does not always get the emergency support they need. CAMHS currently only become involved in supporting a child or young person if they are in Category 3 getting more help or for getting risk support. Moving forward, they will become more involved earlier. This is starting to happen in Wiltshire, which now has 12 Thrive Hub secondary schools where staff can offer support to a child or young person with help from CAMHS staff. Each Thrive Hub school has a named CAMHS practitioner for 1.5 days per week. The vision is to be able to roll this out to all secondary schools in Wiltshire. The CAMHS practitioner can provide guidance on how to support children and young people with mental health issues and upskill teaching staff so they have the confidence to support and talk to pupils without the fear of making things worse. There was feedback in the room from a parent who had a child in a Thrive Hub school where the child was assessed by CAMHS in the school itself in a safe environment. It was also felt that there must be consistency of staff in order for the child or young person to develop trust with that person. For each category of need, there is a level of support available to families, which is described by the diagram below. Coping. Access to digital support via email or phone. There was discussion at consultation around the benefits of information technology which could be useful for young people, particularly those on the autistic spectrum, who may be keen on technology and need access to support. Skype and FaceTime CAMHS consultations are available. A parent advised that their child did not want to go to an appointment due to take place the next day. On returning from our consultation, the parent contacted the professional to ask if the consultation could take place over Skype, as the young person did not want to attend the clinical setting. This was possible, and the parent reported back that the Skype appointment was a success, and the young person and parent got just as much benefit from it happening via this method. Youth.com provide online counseling. Support is also available in schools for pupils. Thrive Hub schools also run evening courses for parent carers which offer help and advice, for example how to support young people with exam stress, keeping young people safe online. This group requires extensive longer-term treatment, so CAMHS will become involved at this level. For example, young people with eating disorders may need residential help over a long period and family therapy. It is felt that early intervention is needed for those children with psychosis, but there is currently a lack of help for those aged under 14. This follows the National Institute for Health and Care Excellence NICE guidelines. The psychosis team is part of adult services. Risk management. This group require a multi-agency response. Parents and carers who attended the consultations were then asked to take a look at this diagram showing the proposed new service model and comment. Consultation questions. 1. What do you like about this model? What are the strengths of this model? Specialist pathways are good provided they actually meet the needs of the child or young person. They need to be focused and developed. The diagram is inclusive and jargon busting. The stages are easy to understand. Self-referral by parent, carers or the child young person. CAMHS will look at any referral going in and identify the help needed and work with other organizations to get the help and or support. Having CAMHS in schools and the ability to self-refer will ease stigma attached to mental health and need for a middleman. Single point of contact and advice line. The out-of-hours service. Mental health practitioners being available in A&E departments. Having schools involved in promoting emotional health and well-being and supporting families throughout. The access to digital support via CAMHS. The availability of peer mentoring. Strengths. Engagement with schools and the Thrive Hub project. The removal of the threshold for access. With bands, Wiltshire and Swindon coming together for CAMHS. Access being available via different routes, that is self-referral, professional referral or via CAMHS itself. 2. What concerns do you have about this new model? What are the weaknesses of this model? The lack of primary school services. Closer ties are needed with primary schools, but with over 250 in the county there is just not enough CAMHS staff to go around. It may be helpful to try and engage with cluster groups and Senkos or provide peer mentoring. With the easier access there will be a rise in demand. How will the provider be able to manage this when they seem to be struggling with the current need? Concern around the recruitment and retention of staff. Parents and carers need to be supported and know how to access and achieve support, especially for abused children. A carer also identified a gap in CAMHS staff training when dealing with children with sexualized behavior and thought there was a lack of knowledge on how to support the family. James advised training is happening at the moment and CAMHS have now appointed a worker for that. CAMHS also had a worker taking the lead for children and young people who have experienced sexual abuse. 2. What concerns do you have about this new model? What are the weaknesses of this model? Continued. How will the service work for those transitioning from CAMHS to adult mental health services? Access to CAMHS ceases too early at 18 as the new Education and Healthcare Plans EHCP run to age 25. Adult mental health service criteria is even higher than that of CAMHS, and they tend to work with the individual rather than the family as a whole. This can be especially difficult when a young person is functioning at a much lower age than their chronological age. There is no pathway for those children and young people who are looked after, adopted or on the autistic spectrum. 2. What concerns do you have about this new model? What are the weaknesses of this model? Continued. Behaviors need to be witnessed in a school setting to access support. There are poor EHCP links. What about those children and young people who are home educated or need, not in education, employment or training? CAMHS need to record and share information more. Do they listen to a young person enough before discharging them? The model needs to move away from the corporate model. When consulted, children and young people agreed with this and preferred a slide which showed the model as a tree with many branches. 3. What is the most important part of the model to get right? And what should be prioritized? Early intervention is key, as many Thrive Hub schools are in areas of deprivation. Support for their feeder primary schools would be helpful. Age barriers, conditions, diagnosis and support. There are fractures between services. Make sure that specialist pathways are thought through and patch these fractures. The services need to be joined up. Nice guidelines can sometimes be unhelpful, so services have to be creative in the ways they use resources. There should be a focus on pathways for multiple needs like autism and eating disorders. Also groups like adopted or looked after children. There is a lack of beds and inpatient services. There is a need for a crisis center with direct access for children and young people. 3. What is the most important part of the model to get right? What should be prioritized? Continued. Matching the child or young person with the appropriate specialist or therapy. All professionals need to be aware of the needs of a child or young person with mental health, especially those with ASD. Professionals also need to be aware of compliance or masking behaviors of some children with ASD. Social needs and friendship groups should be included. There should not be a reliance on digital support, as this is not suitable for all children and young people. Personal relationships are also important, as is consistency of staff. 3. What is the most important part of the model to get right? What should be prioritized? Continued. Is the out-of-hours service relevant to mental health? There is a lack of understanding from social care services. There should be adequate mental health training for all staff involved with children and young people. There is concern around rigidity of criteria to access the service. 4. How should we measure the success of this new approach? What key performance indicators should we use? The difference between outcome and output should be recognized. The tracking of the individual. Look for feedback from the child or young person. Surveys should be done as spot checks on the service at any given time. The ratio between success and satisfaction with the service. A joined-up service with GPs, schools, hospitals, support groups, CAMHS, social services and families. A pathway for those on the autistic spectrum. Early diagnosis. Success can be measured by the decline in the number of children and young people needing long-term or emergency support. What key points were raised from the consultation? Intervention and support needs to start sooner to avoid getting to crisis point. Finding a way to offer access to support via primary schools would be helpful. There needs to be a pathway for those children on the autistic spectrum. A pathway for looked after and adopted children and young people with attachment issues. Joined-up services are needed with training in mental health given to all staff working with children and young people. Families need the right people with the right skills at the right time. There needs to be consistency and continuity in staff and support. What key points were raised from the consultation? Continued. There needs to be a holistic approach that involves the whole family or household with support. Parents want to be treated as a partner by professionals and spoken to in a non-judgmental way. These good relationships will help the whole family and are key to therapies working. How many hoops do families have to through before they move from the coping group to at risk? There needs to be better and timely communication between services and families. Expectations need to be managed. So, for instance, if there is going to be a long waiting time, communicate this to families via a telephone call or letter. Make access easier for those children and young people who do not attend school. Children and young people's feedback should be taken seriously and treatment changed if necessary. Conclusion. The Wiltshire Parent Carer Council, WPCC, would like to thank everyone who took part in our consultations. There were some excellent conversations and points raised during the sessions which have been highlighted in this report. These will now be shared with commissioners and a service provider to ensure that the views of parents and carers of children and young people with special educational needs and/or disabilities are represented when developing Wiltshire's children and young people's mental health services and help to shape the new CAMHS service model. The WPCC will also be running a survey on the CAMHS model from Friday 5th to Sunday the 14th of May 2017 so that any parent carers who were unable to attend our face-to-face consultations can also have their say, or for anyone who has further comments to add to their existing feedback. Looking at the future, once the new service is in place. The WPCC proposes that we give parent carers of children and young people with special educational needs and/or disabilities further opportunities to attend question and answer sessions where we can get together with CAMHS, Oxford Health and commissioners to see how the new service is progressing and to answer any questions that parent carers may have, which in turn will help improve outcomes for our children and young people who are experiencing mental health problems. We have been running similar Q&A sessions with Virgin Care for the new Community Children's Health Service in Wiltshire, which have proven very effective.